Dear colleagues, my name is Professor Natalia Linkova. I'm the expert of Peptides company, and now the theme of my lecture is clinical and experimental studies of the effectiveness of vascular peptides. Cardiovascular disease is the leading cause of death worldwide, killing approximately 18 million people each year. Cardiovascular disease is a group of disease of the heart and blood vessels, which includes coronary heart disease, cerebrovascular disease, rheumatic heart disease, and other pathologies. More than 4 of 5 deaths from cardiovascular disease occur as a result of a heart attack and stroke, and third of these deaths are premature and occur in people under 17 years old. So peptides and non-peptides bioregulator is very useful for prevention and complex treatment of cardiovascular disease. The first peptide bioregulator is Wentworth. Wentworth is a complex of peptides isolated from the blood vessels of cattle, which belongs to the group of cytomedins. Wentworth is a regulator of vascular function which is produced in the form of dietary supplements, capsules and drop under the tongue, lingual form. The active principle of the polypeptide complex of blood vessels Wentworth is the tripeptide vasogen, which includes lysine, glutamine, and aspartic acid. Vasogen, like Wentworth, is a regulator of vascular functions which is produced in the form of dietary supplements. Wentworth and vasogen have a wide range of indicators for use. It's prevention of atherosclerosis and vascular disease with genetic prediction, stress factors, adverse experimental influence, elderly and senile age, lipid metabolism disorders. Although Wentworth and vasogen is useful in the complex treatment of diseases that are accommodated with circulatory disorders. This is obliterating endothelitis, cardiac ischemia, hypertonic disease, chronic venous insufficiency, angiopathy of any origin, and atherosclerosis or vascular lesions. Although Wentworth and vasogen can be useful in rehabilitation after heart attack and prevention and recovery after cerebrovascular accident. So this is the clinical data of effectiveness of vasogen in chronic arterial insufficiency. The investigation includes 41 patients with low limbs ischemia. The first group was the control and the second group was with applying vasogen, 1 capsule per day during 1 month. It was elderly and old people. Inclusion criterion is the degree of ischemia of the lower extremities is not more severe than 2B stage, and exclusion criterion is the presence of clinical ischemia of the lower extremities, pain at rest, necrotic change in the distal segments of the limb, endogenous intoxication syndrome. We investigated 2 parameters: pain-free walking distance is the distance that patients with atherosclerosis can walk before the appearance of pain. And the second is ankle brachial index, reflects the degree of impairment of arterial blood flow in the legs. So it was shown that vasogen significantly increased the pain-free walking distance and ankle brachial index by 61% and 53% compared to the control. The next investigation is about Wentworth. It's about safety and in vitro studies in organotypic cell cultures. Preclinical studies of acute, subacute, and chronic toxicity conducted on mice, rats, and guinea pigs showed the absence of side effects with single and long-term use of the vascular polypeptide complex in doses exceeding the therapeutic dose by the 3,000 or 300 times. Also, Wentworth stimulates the growth or organotypic culture explants of red vessels by 25%. This is the investigation of clinical efficiency of Wentworth. It was patients with cerebral atherosclerosis, the control group, which patients have standard therapy, and the main group, which patients have standard therapy and injection of vascular polypeptide complex once a day for 10 days. Complaints before treatment, the clinical manifestation of cerebrovascular disorders, impaired memory, concentration, affective lability. Patients' complaints were assessed over time. A general clinical examination of blood and urine and biochemical study of blood were performed. It was shown that the use of vessel polypeptide complex helped improve overall well-being, reduce emotional lability, stabilize mood, and reduce anxiety. Patients noted improvement in memory and concentration. So we can see that vessel polypeptides complex decrease the level of total cholesterol in the blood on 28.5% compared to this indicator before treatment. Although this polypeptide complex reduced on 33 patients the content of atherogenic very low density lipoprotein and cholesterol. This indicates the normalizing effect of Wentworth on the metabolism of the vascular endothelium. Also, vessel polypeptide complex improves the short-term visual memory on 36% compared to the value before treatment and on 28% compared to the standard treatment. Polypeptide complex of vessels improves the working memory on 34% compared to the value before treatment and on 25% compared to standard treatment. And this polypeptide complex increases logical thinking on 28% in comparison to the control. This indicates a normalizing effect of polypeptide vessel complex on cognitive function in cerebrovascular disorders. So we have two non-peptides bioregulators that is useful for blood vessels and head. The first is Adestab. It can be used for primary prevention of cardiovascular diseases starting from 40 or 45 years, and for secondary prevention in combination with prescribed therapy for coronary heart disease, atherosclerosis, arterial hypertension, cardiomyopathies of various origins, arrhythmia, and heart failure. Adestab includes potassium and magnesium. Potassium and magnesium ions ensure the conduction of cardiac impulses, improve myocardial contractile function, and regulate the metabolism of cardiomyocytes. Magnesium reduces the rate and optimizes the strength of heart contractions. A complex of medical herbs in Adestab have a calming effect on the central nervous system. They also have a mild diuretic and antispasmolytic effect, which helps lower blood pressure. The second non-peptide vasoprotective bioregulator is Previn. Previn increases the functionality of the vascular endothelium, normalizes cholesterol and blood sugar levels, exhibits antioxidant properties, reduces the level of inflammatory mediators, and prevents the spread of the inflammatory process. Previn prevents thrombus formation, normalizes the rheological properties of blood, relieves the spasm of smooth muscle cells of arteries and arterioles. The properties of Previn are provided by the components included in its composition. Hesperidin is a flavonoid, a polyphenol of plant origin which normalizes the metabolism of vascular endothelial cells. Green tea polyphenols are antioxidants that prevent lipid peroxidation and accelerate fat metabolism. Choline is a vitamin-like substance, a hepatoprotector, lowers cholesterol levels and normalizes the levels of lipoproteins in the blood. L-arginine is amino acid that donors nitric oxide, which is powerful vasodilatator. And vitamin PP normalizes the concentration of lipoproteins in the blood and microcirculation and restores the rheological properties of the blood. So we have two schemes for use of peptide and non-peptide bioregulators. The first scheme is for prevention of cardiovascular disease. Previn 1 tablet per day before meals. Other step 2 tablets per day in the morning and evening before meals. Vasogen or Venford 1 or 2 capsules in the morning during 30 minutes before meals, or 10-20 drops under the tongue 10-15 minutes before meals 2 times a day. Course duration is 1 month, and you can repeat it after 1 or 3 months. Preventive courses must be carried out 2 or 3 times a year. For the complex treatment of cardiovascular disease, we have the same peptides and non-peptides bioregulator, but we can use 2 tablets of Previn and use Vasogen or Wentworth not 2 but 3 or 4 times a day. A course of duration in this case can be from 1 to 3 months. Also, we can repeat it after 1 and 3 months. I hope that this information will be useful for you, and thank you for your attention.